You may just write it off as shoulder pain, but it could mean that you actually have a torn rotator cuff. So, what should you do? Dr. Michael Gilbert joins us to discuss how tears happen and what your plan of action should be. Rotator cuff. This is a new topic for us. What is it?
So many people typically get confused on what a rotator cuff tear is. Shoulder pain is really common, and most people think the rotator cuff is an actual cup or structure in the body. And in reality, it's 4 different muscle groups.
Interesting.
So if we look at the model here, a rotator cuff is going to be located on the front, the top, and the back of the shoulder. So right now we're looking at the front of the shoulder, and there's a muscle that comes across the front. There'll be a muscle that comes right through this space here across to the outside, and then there are 2 muscles that come across the back.
Okay.
And it's the functioning of those 4 muscles together that help keep the arm in a neutral position as it rolls and glides when someone lifts their arm overhead, for example.
So then how does the tear happen? And when you tear it, are you tearing all of those muscles or one part? Explain it to me.
So a tear can happen one of 2 different ways. It can be from a traumatic onset, such as someone falling or lifting something very heavy, or it can come on gradually or chronically over time with someone who may repetitively lift the arm up for an occupation, for instance. Now the location and severity of it matters as well.
Okay.
And I think we have a picture of it as well that's going to show what's a full thickness versus a partial thickness rotator cuff tear. And if you look, the one that has a full thickness tear on it is bigger than the one with a partial thickness tear. Now, someone with a bigger tear is going to have more functional loss in the arm.
Of course.
And depending on if one or more of the muscles are involved, you would have more loss. The less damage, obviously, the more capable that person would be to repair it conservatively and have a normal functioning arm.
If this happens, is it something it's obvious what it is, or can it just feel like a strain or just a little soreness?
Well, usual signs and symptoms of a rotator cuff tear are going to be pain that's in the shoulder or possibly referred into the arm. Weakness of the arm will be present, and someone will have a hard time lifting the arm overhead and more than likely have a hard time sleeping. That might be on it, or a lot of people like to sleep with their arm up overhead.
Yeah.
That would also be a problem for those folks as well.
So do you definitely need surgery and then physical therapy, or can physical therapy kind of get in there before surgery? Like, explain kind of.
Well, physical therapy can help before or after surgery.
Okay.
So there's actually a recent study out that had been taking place in January of this past year, and it was in the Journal of Bone and Joint Surgery. They noted that people who had physical therapy, as opposed to just surgery, at a 1-year point were just as effective in terms of alleviating pain and restoring function. Now, it does depend on how severe the tear is on whether or not that would happen, but for the most part, folks who would go through physical therapy first may be able to do just as well.
Huh. Isn't that interesting? So tell us about your offer. You always bring us an offer.
Sure. So the offer that we're going to have today is for anybody who would have shoulder pain. Now, this is going to be exclusive to the first 10 callers who would call in from the show. We're looking for someone who would have insurance and someone who would have shoulder pain that may refer into the arm, weakness of the arm, trouble lifting the arm overhead, and we're going to give away 10 free screens to someone who thinks they may have a rotator cuff tear, and we'd be able to bring those folks in and tell them if we'd be able to help them or not.
Yeah, and hey, maybe it's not a rotator cuff tear, and
Correct.
you can help in other ways too. Where
Absolutely.
are you located?
So we're on the Carlisle Pike in Mechanicsburg.
Very good. Nice, easy peasy location too.
Yes.
Dr. Gilbert, thanks for making another house call for us today. We always appreciate your advice.
Thank you.